You read the label for 20 minutes in that aisle. You compared CFU counts, strain names, refrigeration requirements. You paid $65 for the bottle with the clinical language and the third-party seal. Then you took it every morning for 4 months. Nothing changed. Your digestion is the same. The bloating is the same. The fatigue is the same. You followed the protocol. The product delivered nothing because the product was never designed to deliver anything. It was designed to sell. The $50 billion global digestive health industry is not a medical category. It is a marketing category built on a single regulatory gap that every major player in this space exploits deliberately, and that most gastroenterologists will not explain to you because the language on the label was engineered to sound medical without being medical. This is not a supplement failure. This is architecture. The company that built this architecture has a name, several names. Nestle Health Science acquired Atrium Innovations in 2017 for $2.3 billion. Atrium owns Garden of Life, the certified organic whole food brand with the clinical-looking label you trusted in that aisle. It is a Nestle property. Danone owns Activia. Activia markets Bifidobacterium animalis DN173010 as a proprietary strain with clinically studied digestive benefits. The strain is real. The clinical studies were funded by Danone. The FTC settled with Danone, Danone's U.S. subsidiary, in 2010 for $21 million over deceptive health claims, and required the company to stop asserting that Activia relieved irregularity unless consumed 3 times daily. The advertising did not specify that dosage. They paid the fine. The brand positioning did not change. The mechanism is the same in every case. The Food and Drug Administration does not require probiotics sold as dietary supplements to demonstrate efficacy before sale. The only regulatory bar is that the product must not claim to treat, cure, or prevent a disease, which is why every label says supports digestive health instead of what it would have to prove if it said anything more specific. Supports is not a medical claim. It is a legal escape hatch, chosen deliberately. This is not an oversight. This is a design choice. The CFU number on the label is not a dosage. It is a marketing unit. CFU stands for colony-forming units, a measure of viable bacterial cells. The 50 billion figure on the label describes the count at the time of manufacture, not at the time of consumption. Probiotic bacteria are live organisms. They die during storage, shipping, and temperature fluctuation. FDA rules require labels to reflect potency through the expiration date. Independent testing consistently finds many brands fail to meet those label claims by the time the product reaches you. There is no penalty structure that makes this visible on the shelf. The label was designed to give you a number. The number was not designed to survive until consumption. Strain specificity is where the gap between marketing and microbiology becomes structural. The research supporting specific probiotic interventions is strain-specific, and the evidence for Lactobacillus rhamnosus GG in reducing antibiotic-associated diarrhea is not transferable to a different Lactobacillus rhamnosus strain. These are different organisms. When a label says Lactobacillus acidophilus, it is telling you the species. It is not telling you the strain. That distinction determines whether any published study applies to what is in the bottle. The research is real. The product is not the research. One more mechanism is gastric survival. Probiotic bacteria must survive stomach acid to reach the large intestine where they function. The phrase enteric coated on a label is the specific term that indicates acid-resistant delivery. Delayed release is a broader category. It does not guarantee the capsule survives stomach acid. Many products use neither. Standard capsules begin dissolving in stomach acid immediately. Brands are not required to disclose this. You paid for viable bacteria. You may have consumed a protein powder. There is a database the gut health industry does not advertise. The United States Pharmacopoeia, USP, maintains a verified mark program. To carry it, A product must pass independent third-party testing, confirming it contains what the label states in the amounts stated without harmful contaminants, and that it will break down appropriately in the body. The brand pays for the testing, but does not control the outcome. The full list is publicly searchable at usp.org. Search for probiotics. The list is short. Most brands in that aisle are not on it. The question most people never ask their gastroenterologist is this: what is the full strain designation for the probiotic you are recommending, and what peer-reviewed study supports that specific strain for my specific condition? Not the genus, not the species. The alphanumeric suffix, such as GG or 35624, identifies a specific organism with a specific evidence record. If the answer is any Lactobacillus acidophilus, the recommendation is not evidence-based. It is a category suggestion. That is a meaningful difference. The calculation: a USP verified probiotic retails for $20 to $40 per month. Influencer partnered premium brands retail for $50 to $90. The higher priced product has no additional evidence. It has a larger marketing budget. The difference is not quality. The difference is distribution cost and brand equity acquisition. You have been paying the marketing premium. There is no product premium underneath it. $50 billion is real. The products are not. They built a regulatory gap into the foundation. They filled it with colony-forming units and strain names. They licensed the language of clinical research without the methodology. They paid for endorsements and called them recommendations. You were not wrong to want this to work. You were working with incomplete information that was deliberately kept incomplete. Now you have the information. The USP database is public. The strain designation is a question you can ask. Enteric coded is a phrase you can find on a label. The certificate of analysis is a document you can request. They cannot sell a fiction to a woman who knows the architecture. You are now the most dangerous thing to their business model, a woman who knows. If you made it this far, subscribe. I cover the wellness industry's paper infrastructure every week.